Hello, everyone. This is Dr. Ola Kolawole, founder of MedmatchMD, a board-certified family practice physician. And today I am here with Dr. Oni. Before we proceed, for those who don't know, MedmatchMD is an online platform that helps pre-med students make an educated decision of choosing the right offshore Caribbean medical school so they can fulfill their dream of becoming MDs. MedmatchMD compares close to 40 different Caribbean medical schools side by side so students can make a decision of choosing the right school. Now, for the exciting part of today's Zoom call, we have today with us Dr. Oni. Dr. Oni is a family practice physician and a very good friend of mine. We've been friends for close to 35 years, matter of fact. We're childhood friends, and today we're both family doctors. Both have fulfilled our dreams of becoming MDs. So without much further ado, I would like to invite Dr. Oni to tell us a little bit about herself. Dr. Oni.
Thank you, Dr. Kolawole, for having me on this call tonight. This is quite exciting. It's been a long time coming. It's amazing that we can both sit here and say, yes, we're physicians now. So again, just a brief introduction. My name is Dr. Oni, board-certified family physician, also certified magnetic resonance technologist, also certified nuclear medicine technologist, of course, all in a former life. But also, mom to four beautiful kids. So just happy to be here tonight.
Awesome. So Dr. Oni, you have an incredible story on how you decided to take this path of becoming a physician. And I would like you to let us know, well, first of all, what made you decide to become a doctor?
So this is sort of, this is funny because it's almost taking me back to when I wrote my, my personal statement back for applying for med school, same thing applying for residency. But again, like, we've been friends since, since the 80s.
Yeah.
Although I'm mistaken myself, we both don't look that old. But I always wanted to be a doctor, which was same as you. And I remember, when we were pretty much in, I would say middle school, and we both used to say, "Oh, I want to be a gynecologist." Even at that time, I wasn't sure I knew what a gynecologist meant, but I knew I was a doctor. And so it was just, it was a childhood dream, of course, kind of like a little bit where we're from originally. It's all, either a doctor, a lawyer, engineer, or whatnot. So I guess, doctor sounded nice and sounded glamorous. But of course, as I got a little older, I did lose my mom, my paternal grandmother, to cervical cancer, and just seeing, how she went through that, the kind of challenges that she faced as as a patient, and of course my parents as well, not really being able to be informed about what was going on. There was a lot of confusion regarding her condition, and I just wished, that I was in a better place, even as young as I was, wishing I was in a better place to be able to at least help understand what was going on so I could explain it to my family. And I think that just sort of helped to cement, that initial childhood dream that was like a spark. And it just became something that was, I think I really, really have to do this. Of course, you do know my story, and my trajectory to becoming a doctor, of course, was nowhere straightforward. At some point, I abandoned the dream and thought, what, forget about it. Right. But somehow, in the end, I still kind of got led back to that place of, okay, I guess this was a dream that the spark didn't die and the embers were still there slowly being fanned until, it blazed up again into a burning flame.
That's an amazing story. And, it's interesting because a lot of us start off with having the dream, right? Mm-hmm. And, different things happen along the way, and you end up either putting it on the back shelf or decided not to even fulfill that dream anymore. But somehow we were just, brought back, to making sure that we end up, in that path to becoming MDs.
Yeah.
So, an amazing story you have there. So next question I have for you today is, so what made you go to a Caribbean medical school?
Okay, so this is kind of a little, it amazes me myself sometimes when I think about it. Of course, like I kind of alluded to originally when I, started talking, I had life had taken me different directions. And so it got to a point where I thought, okay, well, if I can't be a doctor, this is going to be so much of a long process. I'm already married, I have kids, it's too late. So I'm just going to do something else. And, if I can do something that's, still in the healthcare field, something healthcare related, maybe that would satisfy that itch, and then it's okay, and my kids will pick up from where I left off. Hopefully one of them will want to be a doctor too. And so had I had gone back to school and studied to be a nuclear medicine technologist, which is noble and interesting because that's part of diagnostic imaging. However, again, it was like events just kept pushing me toward that. This is still unfinished business that you need to finish. Because just when I finished, studying nuclear medicine technology, there was a worldwide shortage of nuclear isotopes. And so I couldn't even find a job. And so I was like, okay, well, what now? Well, I still want to be, in healthcare, but of course, being a doctor is, forget about that. And so I went back and, studied MRI technology, and I did become an MRI technologist, and I started working that. I love my job. Love meeting the patients, getting to see all this interesting pathology, maybe not interesting for the patients, but interesting for me. And then always just thinking, but what now? What next? You see a patient who has this, you talk to them, you forge a little bit of a relationship with them in the few minutes you have to spend with them. And then you're kind of curious, well, what happens next after this? You may never see them again. And so something just kind of sparked back again, wanting to know more, wanting to be part of that decision-making process. What happens to this patient? Wanting to be there as a support, even sometimes when they're going through what they're going through. And so that kind of reopened again, can I still go be a doctor? So interesting. I always tell people my story wouldn't be complete without you, because I remember the day I called you and I said, I've started thinking about this again. And you were like, well, so why don't you do it? And I thought, but I'm old, I have kids, and you made that statement, and I always say that. And it's actually interesting because we had talked about this during my residency graduation, because you said, whether you go or not, you're going to be 40 anyway. So would you rather be 40 and be fulfilled and know that, you pursued this at least to a logical conclusion, or you'll be 40 and just full of what ifs? What if I had done it? What if I had or hadn't? And so this is kind of a long meandering way of getting to the answer to your question, but why Caribbean Medical School? I guess at that point, after talking to you, I thought, okay, well, she did it, so why can't I? And so I started looking into it again, and I just found, that those schools, or the school that I eventually ended up going to, which of course was Ross University, they kind of looked at me as a holistic individual. It wasn't just about my MCAT score, but it was also, what about the life experience that I bring? Because of course I was bringing quite a bit of baggage, whichever way you look at it behind me. But also that was a positive that kind of went in my favor. So as a non-traditional medical student, older, I had already changed career like 2 or 3 times. So, benefit of the hindsight, those things that I was bringing with me, I guess, I like the fact that because the school looked at me as a whole individual and it wasn't just about my score.
Excellent. Yes. And you're so right. Caribbean medical schools, have a more holistic approach of looking at applicants and looking at their backgrounds and not necessarily focusing just on a score, which makes it actually very, very attractive. So yes, you're totally right on that. And also you mentioned something that was really interesting as far as, how you decided, how you first of all went into nuclear medicine, and you had these I won't call them distractions because, it made you into the person you are, into ultimately.
I always say detour.
Detour, yes, that's the word. That's the word I was actually looking for. But it's interesting. I'm not sure if you know this, but I also had a detour. I ended up going into physical therapy. I went into a master's program in physical therapy for the, similar reasons. I was telling myself I don't want to spend all those years in medical school. I'm gonna be so old by the time I'm done. And so for that reason, I went into a master's program in physical therapy. Not that there is anything wrong with physical therapy. I think it's an amazing field. But as time went on, I just, I didn't feel like I was fulfilling my dream, and after a year of a master's program, I decided, I really need to get back. I really need to get back on that initial dream that I always wanted. And so that's, somewhat similar to your experience.
Yeah, and I guess for me, that's just confirmation that this is
Yes.
where you were meant to be.
Yes.
This is where you were meant to
Yes.
be.
Yes.
You just couldn't stop until we got to that point.
Exactly. And when I was finally there was nothing else. I mean, that was it. So so all right. So my next it won't really, this is not really more of a question. We'll just talk back and forth on this one. There are a lot of myths that people have about Caribbean medical school, and I would like us to, talk about a couple of them and try to debunk those myths for our listeners. So one is, if I go to a Caribbean medical school, no one would, I won't get into residency, or I won't get clinical rotations in the U.S., or I'm going to have to be a Caribbean doctor, all sorts of myths that are out there. So we could just talk back and forth and try to, help our viewers understand how these, these are not necessarily hindrances, and how we overcame those.
Yeah, that's actually quite a good point that you bring up because, to be honest, I wish a platform like MedmatchMD had been available. And at the time, I was actually thinking, okay, now I want to go ahead and do this because what MedmatchMD does is it puts all the schools that are out there kind of, sort of on an even playing field, and then compares them so that a student or student who's potential applicant can then make an informed decision. Like at the time I wanted to go, there was nothing to go by. You had to, just go on the internet and do your research by yourself. And there were, oh my God, there was a ton of misinformation out there. And so I'm actually glad that you bring this up. So one of the first things is, of course, you're not going to get into residency. Well, at least there's two of us sitting here right now as testament to the fact that, that's not entirely correct, right?
Right.
Although of course it is sort of a different dynamic. Of course, I'm sure when you go to an offshore medical school as opposed to schooling either in the US or in Canada. However, at the end of the day, the way I think about it, at the bottom line, it is still up to you. Yes. Kind of what you make of the opportunity. I saw this as an opportunity. Oh gosh, I don't know if I misuse this, am I ever going to get a chance again? And so, you have to sort of consider where you're coming from and kind of keep your eye on the prize. And this is where I want to get. So regardless of whatever odds are there against me, I'm going to buckle down and make this work. I think at the end of the day, although, now, I learned that USMLE scoring is going to sort of an entirely different model. But back then, you had to kind of like focus on your step 1 score and your step 2 score. We all take the same exam, regardless if you're an IMG or you're an AMG. Take the same licensing exam. So at that point at the exam center, no one's asking you, are you from an offshore medical school or are you an AMG? We take the same exam, we study the same material, and it's up to you. Your score, it's I don't want to use the term it's entirely in your hands, but a lot is riding on you and what you make of that opportunity. And so at that point, after that, residency programs, again, I like the fact that they also sort of look at you as a whole individual and not just based on that one score. But, I think that's a myth that's really out there. And I'm glad we're having this conversation so that people can know, that's not entirely true.
Right. Exactly. And you raise a good point in the fact that the onus is on you. you know, the schools prepare you. I think any school, really, the onus is on you, whether you go to a U.S. or Canadian school, or you go to a Caribbean school. You need to do the work.
Yeah.
You need to do the work. You need to study. You need to prepare. Everyone, you know, takes the same exams, like you know, rightfully said. You know, so if you do your due diligence, you make sure you go to classes. You make sure you study hard. You make sure you buckle down. You set your eyes on the prize. Really, truly. You know, you will make it, because, you know, at the end of the day, even with Caribbean medical schools, yes, it might not be as competitive as getting into a US or Canadian school. However, once you're in, you better be ready to work
Yeah.
hard.
Yeah.
You
Yeah.
know,
You're
so
correct.
yes, so you know, I'm glad we talked about that. So another myth would be, so that if you go to a Caribbean medical school, well, what would patients think of you, or you know, if they know you went to a Caribbean school, or what would other medical students, you know, that your peers that went to U.S. schools, how would they, you know, what would they think of you, you know, if when you're back, you know, doing your rotations, you know, people just have a lot of these questions, and they just, you know, people feel that no one wants to feel less than. So for that reason, there's always that apprehension about
Yes.
doing something that is non-traditional, you know, or going a route that's non-traditional. So, you know, we could just talk about those fears as well.
Yeah. I'm not sure what your experience has been, but you know, in my case as well, of course, by the time you do come back stateside, after doing your didactics in the Caribbean, when you come back stateside for your clinical rotations, and I do also even have some friends who ended up going back to Canada to do some clinical rotations there as well. Of course, we were side by side with, you know, other medical students from American schools. And, you know, for me, there was no discrimination. You know, I didn't, none of the students made me feel less than or like a second class citizen or whatnot. And the attendings, believe me, I don't think the attendings cared.
Right.
On rounds, you had to be sharp, you had to have
Yeah.
your answer, you know, you had to be prepared to present your patient. No, at that point, no one's asking what school did you come from or not. As long as, you know, you have the answers, you're there to with a sharp mind, inquisitive mind, ready to take the initiative with your patients, ready to learn. No one asked me, you know, what school are you from? Hey, you, what school are you from? And
Right.
I found it's been the same with my patients as well. You know, patients walking in, sometimes they come in, you know, because they have questions, they're confused about one thing or the other, they're scared about a new diagnosis, they have questions. At that point, no patients asking me, hey, did you go to a Caribbean medical school? You know, or what medical school did you graduate from?
Right.
At that point, all, you know, they know is, here's my doctor who's gonna, you know, answer my questions and, you know, try to, you know, help me understand what's going on. So I haven't really you know, noticed any discrimination from anybody. It was the same thing during residency, you know, and my cohort during residency were a pretty diverse group as well. We had IMGs, AMGs all mixed together in the same, and we were all going through the same challenges. You know, we're going through the same struggles as we, you know, kind of move through residency. So at that point, I think it becomes a moot point at that, you know, at that point,
Yeah.
once you're, you know, you're done, you're matched into residency. I think that's all, you know, sort of, you know, it's no more, it's not the issue.
Right. Exactly. Exactly. And for the benefit of those who don't know, IMG is an international medical graduate. AMG is an American medical graduate. And also, just to help our viewers, offshore Caribbean medical schools are essentially, you go to the island for 16 to 24 months, you return to the United States, and you go for your clinical rotations. And after your clinical rotations, you know, you apply to get into residency, just like your peers that went to American medical schools. And really that is the process. So okay, well, this is really, really very, very informative, I believe, for our listeners. One last question I would like you to answer, Dr. Oni, for me today is, what advice would you have for for a pre-med student, an aspiring doctor who is looking to take the same path, or not even sure whether this is the path for them, what advice would you have? Or for those even that are applying to Canadian or U.S. schools, because at the end of the day, one thing I always tell students is, keep your options open. Because, when I was applying, I applied as well to Canadian and U.S. schools as well. But at the end of the day, I always tell students, less than half of those, less than 50% of those who apply to U.S. or Canadian schools actually get accepted. So what advice, in a nutshell, would you like to give our students?
I think the biggest thing I would say is don't give up. Don't give up. Like you just rightly mentioned, the statistics out there can sometimes be overwhelming. If you consider that up to 50% of people who apply get rejected, I do know people who have applied, multiple cycles before then being accepted. They've had to take the MCAT, which is the med school entrance exam, multiple times. So the first thing I would say is don't give up. As long as you're convinced this is what I want to do, there's more than one way to skin a cat. That's let's put it that way. So, if I'm trying this route, like you said, and maybe this route isn't working out well, maybe I should try the offshore route. But regardless, keep your options open and don't give up. That would be the biggest, the first thing I would say. And kind of to tie into that as well is just keep your eye on the prize. There may be, like you said, there may be detours in your own journey to get there. There may be distractions, which again, rejection or even sometimes failure of a standardized exam might be, there as a distraction. But as long as you're convinced this is what I want to do, keep your eye on the prize. Ultimately, though, I just want to put out a caveat there that there might be some people who might end up at the end of the day not deciding against going, as long as you're confident of your decision and you know that you have explored this to the fullest of your ability. Okay, then maybe, but I would say don't give up until you really know.
Excellent. Thank you so much. So this has been an amazing, amazing time we've had together. I really appreciate your insight. I appreciate your time. I know this is a busy time for both of us, being in practice, taking care of our patients on a daily basis. So I really do appreciate the time you've spent talking about your experiences and also given a lot of insight and advice to our pre-med and students and aspiring doctors. So thank you so much.
Thanks a lot for having me, Dr. Kolawole. And if I can throw in a last word to, pre-med applicants, I would say go out there and, go on MedmatchMD.com and, just browse the website. Play with it. It's interactive. I think it's a valuable resource. Like I said earlier, I wish I had something like this available when I was doing my own research, because then I had to rely on a lot of negative information out there. At some point, I almost even said, maybe I should forget this all over again, but having all that information curated in one spot, it's like a one-stop shop, makes it a little bit easier for you to streamline, based on tuition, based on cost, based on location, based on, what's the residency match, match rate. That's important information that you need to have. And so when you put all those things together in one spot, then it will help you make a better informed decision. So I say go check the website out.
Thank you. Thank you. And for those that need, Dr. Oni just mentioned the website. It is MedmatchMD.com. Visit, and we have a blog on the site that also gives you tips in applying to Caribbean medical schools. We have testimonials by amazing doctors. You'll get to see Dr. Oni as one of the docs there, as well as very, very successful doctors that are on the platform as well. And of course, close to 40 schools that are listed on there as well. You can follow me on Instagram, Doc Ola MedmatchMD, Facebook, Doc Ola MedmatchMD, and I'm also on LinkedIn as Dr. Ola Kolawole MedmatchMD. All right, well, thanks listeners, and once again, Dr. Oni, thank you.
All right. Anytime.
All right. Have a
Okay.
wonderful day.
Take care and have a good
Yeah.
evening. Yep. Bye bye.
Bye bye.